Hello students, in today's lecture we will discuss the tympanic membrane. It is another important topic in ear. So we have already discussed the external ear, in which we have discussed the auricle and the external auditory meatus. So in next lecture of ear, that is in today's lecture, we will discuss the tympanic membrane. So coming to the introduction part, this membrane is thin translucent membrane, separates the middle ear cavity from external acoustic meatus. The maximum diameter is around 9 to 10 millimeter. It is placed obliquely at an angle of 55 degree with the floor of meatus. So this membrane is 0.1 millimeter thick and 8 to 10 millimeter in diameter. It is facing downward, forward and laterally. In newborn it is placed horizontally. Because of this placement, that is horizontal placement, they can withstand loud noise. Now this membrane is thickened at the circumference. You can see fixed to the tympanic sulcus of the temporal bone, but superiorly this sulcus is deficient. This temporal sulcus is deficient superiorly. Here the membrane is attached to the tympanic notch, so that is the notch of Ravenous. Now from the ends of the notch, two bands they arise, that is the anterior and posterior malleolar folds, which are prolonged to the lateral process of the malleus. Now keeping in mind this attachment, so the tympanic membrane is divided into two parts, that is the pars flaccida and pars tensa. Pars flaccida is the part between two malleolar fold which is loose. So this part is loose. Another name of this pars flaccida is Shrapnel's membrane. Now pars tensa is large area of the tympanic membrane which is tensed by the attachment of the handle of malleus. So important relation of the pars flaccida is with the chorda tympani, so which is crossing internally. So you can see the chorda tympani on the other side of the membrane, which is facing towards the middle ear. So chorda tympani is present in relation to it. Now coming to the surfaces, this membrane has an outer surface which is concave and inner surface which is convex. The point of maximum convexity is called as umbu. Now it has got three layers: outer epithelial layer which is continuous with the skin, stratified squamous non-keratinized is the epithelium which is covering it, because this portion of the tympanic membrane is just facing towards the external auditory meatus, so that is lined by the skin, so continuation of that is there. Then inner mucous layer is lined by the ciliated columnar epithelial layer basically. So ciliated columnar layer is there which is just covering the inner mucous layer. Then middle fibrous layer made up of superficial radiating fiber and deep circular fibers. So this is the regarding the internal structure of the tympanic membrane. So it is made up of which part? So accordingly, outer, middle and inner is there. Inner is mucous layer and outer is epithelial layer and middle is the fibrous layer. Now this pars tensa is divided into four quadrants by the two imaginary line. One is the vertical line passing through the handle of malleus and another is the horizontal line passing through umbu. Umbu is the point of maximum convexity. Now a bright cone of light is reflected from the anterior-inferior quadrant when the light is focused into the ear, which is called as cone of light. So this is the cone of light. Normally it is seen because of the concavity which is present here. This is due to the concavity of the lateral surface and is lost if the membrane bulges laterally. So this is the very important applied aspect also. Now coming to the blood supply. Now this is supplied by the deep auricular branch of maxillary nerve, just supplying the outer surface of the tympanic membrane, and inner surface is supplied by anterior tympanic branch of maxillary artery, posterior tympanic branch of stylomastoid branch of posterior auricular artery. And venous drainage is outer part of the tympanic membrane is drained by the external jugular vein and inner surface is drained by the transverse sinus. Lymphatic drainage is by the preauricular and retropharyngeal group of lymph nodes. Now coming to the nerve supply. For nerve supply, we just divide the tympanic membrane into two parts, that is anterior-inferior portion and posterior-superior portion. Anterior-inferior part is supplied by auricular temporal nerve and posterior-superior part is supplied by the auricular branch of the vagus nerve. And inner surface, whole of the inner surface is supplied by the tympanic branch of the glossopharyngeal nerve. Now coming to the applied aspect of this, the perforation of the tympanic membrane can occur, which is why it is happening, because tympanic membrane is relatively thin structure which is susceptible to perforation either because of trauma or it may be because of infection. An infection of the middle ear causes pus and fluid to build up behind the tympanic membrane, which causes an increase in pressure within the middle ear, and eventually membrane can rupture. So this is a safety mechanism. Now in some cases perforation heals itself, but in larger cases surgical grafting is needed. Now next applied is absence of cone of light due to loss of concavity of the lateral surface. Now coming to the meningotomy, it is a procedure where surgical incision is placed in tympanic membrane at posterior inferior quadrant. Why? To avoid damage to the chorda tympani. So this is the applied aspect of the tympanic membrane. This is very important topic in here. Thank you very much. If you like my video, I again request you kindly subscribe it, share it.